Sri Lanka is battling the worst outbreak of mosquito-borne dengue in nearly a decade. More than 50 deaths and over 76,000 infections have been recorded since the outbreak began in January, prompting the island nation to turn to its armed forces to help curb the spread of the disease. Our next report brings you all the details.
The South Asian island is fairly acquainted with the scourge of dengue, especially during the monsoon season. However, this year the situation is particularly bad, necessitating the deployment of military. According to official data, in the first 6 months, 61,057 people were infected in the tropical country, which is more than double the 30,060 infections recorded during the same period in 2025. In the first 2 weeks of this month, more than 18,000 cases were recorded, pushing the overall tally closer to 100,000. With hospitals rushing to add beds, convert wards to care for the ill, and step up hours worked by doctors and nurses. Shalini Aloka Pereira, who works as a teacher's assistant in a private school, has opted to be treated for dengue at home.
I had some instructions from my family doctor. Then he asked me to stay at home because my the platelet count is not too much down. Then I did my home meditation at home because too much patients are in the hospital, in the government and the private hospital.
The alarming numbers of the stricken, spread wider by a more virulent strain, has overburdened Sri Lanka's public health services and hospitals and resulted in the deployment of military last month. The heightened strain comes in the aftermath of Cyclone Ditwa, the nation's worst natural disaster, which tore up critical infrastructure and health facilities in late November, causing losses estimated by the World Bank at $1.4 billion. Though Sri Lanka has an advantage of 4 beds for every 1,000 people, which outstrips the average global ratio of fewer than 3, the rapid increase in patients is very challenging, especially in a place like Negombo, one of the worst hit areas.
It's challenging to the doctors because it's a rapid increase of patients. Like all of a sudden you get a big bulk of patients coming into the hospital. So it's challenging. So challenging to the doctors, nurses, the health administrators, everyone. So because you have to use the same resources that we had before.
In a bid to curb the spread of the disease, Sri Lanka has gone all out, with Air Force drones tracking stagnating rooftop pools of water, to military and police officers helping to inspect homes, building sites and schools in a campaign to stamp out mosquito breeding sites. The government's intent can be gauged by the fact that nearly 11,000 mosquito breeding sites were cleared this month, with fines levied at more than 4,000 premises found to harbour them.
The main focus has been getting rid of vector breeding sites and getting rid of vectors by fogging and the usual things. So there's absolutely no doubt that these measures are very, very important. But when you look at the whole world, not just Sri Lanka, these factors alone don't seem to be enough.
Reportedly, authorities are also considering the option of a dengue vaccine, but the experts have warned it may confer limited benefits as the virus is complex and several strains are circulating. The infections are expected to ease off in August as monsoon rains weaken, but could again climb from November as rainfall returns to the island nation in its second annual monsoon season. Here's hoping that the authorities are able to curb the spread of the disease sooner and prevent overcrowding in hospitals.